Now I want to talk to you about labour itself and normal birth. Labour has 3 stages. The first stage is contractions, where you dilate from 1 centimetre dilated to 10 centimetres dilated. The second stage of labour is where you actually push your baby out. And the third stage is when the placenta is delivered. The first stage of labour also has a section called the early latent phase, and this is from when you're about 1 centimetre dilated to around 3. What happens is the cervix needs to thin. It starts out as a tube and it needs to thin itself out so it's flat. And during that time it can be very uncomfortable, like strong period pains or backache. Then the cervix will start to dilate even more once it's thinner. And for this period of time, the early latent phase can last sometimes a couple of days for women, and they generally ring up, come in, get checked over, and if we find that you're in that phase, then we will send you home if everything's fine, so that you can be at home and do normal things to try and distract yourself from it. But once you get to about 3 to 4 centimetres dilated, midwives say that you're in established labour then, provided you're getting regular strong contractions as well, and then we would offer to keep you in hospital and offer you any pain relief that you may require, keep you mobile so that you can help your baby descend. And it's during that time that obviously the contractions will become stronger, more close together, last longer, till eventually become fully dilated. And then when you're fully dilated, we have a period of time where we wait before we start you trying to push your baby out. The second stage of labour is when the mother is pushing her baby out, and this can take up to a couple of hours. What we tend to do is if you're fully dilated and you don't have the strong urges to push, then we will say to you, just try and breathe through, just try and relax and give the baby time for your body to push the baby down itself. And then once your body has pushed the baby down into the birth canal, you probably will then get a very strong urge to push. And this pushing feeling can feel like you need a big poo. And a lot of midwives will say to you, push down like you're doing a really big poo. With that pushing, you're rocking the baby's head backwards and forwards. It goes 2 steps forward, 1 step back, 2 steps forward, 1 step back, and it carries on until after about sometimes up to an hour of pushing, when you're pushing your first baby out, the baby's head will start to crown and we will start to see the perineum bulging and we'll start to see your baby. And at that point we usually say to you, try and just gently pant, don't push. Because as you do that, you're allowing the tissues to stretch and allowing your baby to be delivered as gently as possible. Occasionally, if your baby doesn't deliver completely by itself, you sometimes need an assistance from an episiotomy to help deliver the head, because the perineum occasionally can be quite rigid and taut around the baby's head and doesn't stretch. But that's on very rare occasions. Once you've pushed your baby out, we deliver the baby onto you if you wish. Although we usually have a discussion with you first of all before you sort of get into the throes of things as to where you would like your baby onto you or onto a towel, and then we will need to deliver the placenta. Now, delivery of the placenta can be done in 2 ways. If you've had a completely normal, straightforward labour without any intervention from us at all, other than just a bit of gas and air or pethidine, and baby's fine and you're fine, then what we can do is a physiological 3rd stage of labour, which is where we don't give you any drugs and we await the delivery of your placenta. We don't clamp and cut the cord or anything, we leave it attached to baby, we wait till it stops pulsating, and generally then we clamp it and the placenta delivers by itself. If you've had, if you don't wish to deliver the placenta by yourself, you can have an oxytocic injection, which will help to minimise any bleeding and will aid the delivery of the placenta. This injection is given into your leg as the baby's shoulders are delivering. And when we do that, we clamp and cut the cord, and then we would put baby onto you properly and we'd wait for the delivery of the placenta. Generally, you don't need to do anything yourself. We deliver the placenta by pulling gently on it, on the cord, to deliver the placenta. Finally, what we do is we check we check the placenta over, and we make sure if there's any suturing needs doing, we would do that. And then we also give you time to be with your baby and get to meet your new arrival.